My name is Jim Cox, and I'm the managing partner of McCarthy & Cox. We are all certified financial planners specializing in retirement planning. As you can imagine, having a home office in Marysville, Ohio, we have a number of our clients who are also Honda associates, and that's the reason for this video here tonight. Earlier today, Honda announced a voluntary retirement opportunity for folks that either retired on April 1st of this year and were eligible, or anyone that's age 55 and older with 10 years of service, or age 65 and older with 5 years of service or longer. What the benefit is, and again, please know that this is a fluid situation. This is our understanding of what this benefit looks like at this point right now. Things may change in the days to come, but specifically, the package will come out here next week. You should be receiving it if you are eligible to elect this option, and it should say what your benefit increase is at that time. But here's our information. Here's our understanding of how this works right now. Honda's going to add 4 years to your age, service, and to your base wages for your pension calculation. So assuming that Honda uses the same pension calculation that they had been since 2014, that would mean somebody with a base salary, base wage of $50,000 per year, multiply by 4 more years, that's $200,000 times that 1% calculations for all those folks that took option 1. That would be an increase at the end of the day of about $166 per month under the pension plan payment. And so it's a pretty good benefit. In addition, there's some other cool benefits. For years, a lot of the retirement benefits were capped out at 30 years max, and that's changed now. So now they've gone up to 34 years, specifically on the retiree medical plan credits, the retiree reimbursement account, and the loyalty card. So for instance, on the retiree medical plan credits, folks that were between the ages of 55 and 65, so pre-Medicare folks, would see a $9 per month increase times 4 years. So they should see about a $36 per month increase in their credits, which is another way to say that they'll pay $36 less for health care per month in retirement going forward if they elect this plan. And we assume, this is again assumption, that the spouses would get a 50% of this increase as well. Post-Medicare, age 65 plus, would get an additional $5 per month, so times 4 years, would get an additional $20 per month increase in their retirement credits, which again translates into just paying less for the Medicare supplement plans. In addition to the medical, we also see an increase into the retiree reimbursement account. So if you remember, that was capped out at $30,000. So if you had 30 years of service, that was as much as you could put in there, $30,000. That's gone up now to $34,000. Regardless, you'll get an extra $4,000 no matter what level of service you have. You'll get an extra $4,000 deposited into your retirement reimbursement account. And then finally, the loyalty card will be increased as well. And that is $100 per year. So again, times 4 would be $400 more. And the cap is increased. So before you were capped out at $5,000 of a loyalty card. Now that will be $5,400. So altogether, a pretty good option for people that were looking to retire between, sometime maybe this year or next year for sure. Also, it's sort of the carrot and the stick, because if you choose not to accept this offer and you are eligible, or you wait till sometime after January 1st to retire, the loyalty card goes away. So again, assuming you're maxed out, you could see a reduction of $5,400 right there, because the loyalty card goes away. Also, people who are older than 50 by the end of this year, this doesn't apply to. But if you're younger than that, there's going to be a change that's happening, that post-Medicare age 65 plus medical insurance credits that I just talked about are going away. Also, spousal health care is potentially going away as well in retirement. So there's some good things definitely to take advantage of if you can, and you're eligible to take advantage of. There's also some reasons, kind of the carrot and the stick, if you will, to get out now. Again, this is a very fluid situation. We anticipate that you will get a packet with specifics to your situation and whether or not you should or should not take advantage of that. We encourage you to call your financial advisor to walk them through. Thank you for your time, and we anticipate hearing from you soon.